Pain has reached epidemic proportions in America. I'm Dr. Paul Christo. This is Aches and Gains.
Dr. Paul Christo is one of America's leading experts on relieving pain. He's board-certified, Harvard-trained, and a pain medicine specialist at Johns Hopkins. U.S. News & World Report ranks him as a top doctor and among the top 1% in the nation for pain management. Becker's Review selected him as one of the 70 best pain management physicians in America. He's listed as a super doctor for the Washington, D.C., Baltimore, Northern Virginia area. Aches and Gains is a weekly talk show covering all aspects of pain and pain relief. The human impact is real. Older adults, children, and even infants struggle to cope with pain. But there's hope, and there are treatments that can ease pain and suffering. The show offers compelling stories about people who've found relief. We share cutting-edge treatments from contributing experts, and we offer ways to help people cope with their pain.
Welcome to the show. Being in chronic pain is dreadful, but being in pain and feeling alone is unbearable. In many cases, pain can take over our lives and engulf us in a cloud of hopelessness. It dulls our senses and robs us of purpose. Sleep is disrupted and activities are limited. When medicines, nerve blocks, and even surgery fail to provide relief, we can feel defeated. Is it possible to overcome this harsh sentence and restore vitality and optimism? Jim Brown, our first guest, shares how Take Courage coaching allowed him to triumph over nerve and muscle pain that made him feel like death was the only option for relief. It's a moving story of courage and success. Our second guest, Becky Curtis, believes that there is a way out. She's developed a system called Take Courage Coaching. With the help of personal coaches, people learn to tap their own abilities to feel better and regain lost activities, hobbies, and work. It's a self-management program that re-engages us in life.
Aches and Gains is supported by Medtronic, Mylan Pharmaceuticals, Purdue Pharma, Endo Pharmaceuticals, Horizon Pharma, Pentec Health, and Boston Scientific. For live online listening to Aches and Gains, please go to paulchristomd.com. To access podcasts of the show, please go to paulchristomd.com. If you have any questions or comments for Dr. Christo, please email him at achesandgains@gmail.com.
Jim Brown is a minister of a large church in New York City. He struggled for years to alleviate his intense muscle and nerve pain. There wasn't a treatment that he didn't try. He felt that pain had robbed him of his life until he found Take Courage Coaching. The program helped him reclaim what he once had and thought he'd never experience again. He's here to tell us how. Jim, welcome to Aches and Gains.
Thank you so much. Nice to be with you.
Trace for us the events that led to your condition.
I had a couple accidents. I had a water skiing accident and then a rock climbing accident that tore my rotator cuff, and because of the surgery doing that, something happened with my cervical spine. I still am not quite sure what, but it really left me in chronic nerve pain. It felt like the rhomboid area. It really felt like a stake had been driven through my back and left to rot. And it had residual pain in my arm and my chest. And even though I went to a lot of doctors trying to figure this out, in fact, even after going to specialists at some top hospitals, the doctors were arguing with one another what it was, whether it was muscular or nerve. And finally, they concluded it probably was just chronic inflammation of my cervical spine.
I mean, it seems like you did everything you could to get a diagnosis. Jim, what medical treatments did you undergo?
I had a fusion, and before that I had a foraminotomy on C6, C7, and it made no improvement at all.
And a foraminotomy is performed by a spine surgeon to decrease the pressure on nerves by opening up the passageway for the nerves through the bones of the spine. And Jim, did you have anything else done?
I tried facet injections, I tried trigger point injections, epidurals, cervical radiofrequency ablations, and then a host of medicines, including Mobic, Celebrex, Darvocet, Cymbalta, Lyrica, gabapentin, I believe, Neurontin, something like that. The list just goes on. I was trying everything I could. I think I saw 12 different doctors to try to get out of this pain because it was just so bad.
Jim, how long were you that uncomfortable?
So I think it went on for three or 4 years before I was introduced to Take Courage Coaching. It was a very dark time. I mean, I had basically lost hope. I thought, I can't go on. My life just can't go on like this.
That's terrible. I mean, Jim, it sounds like you were suicidal.
Well, let's put it this way. I wanted to die. I was basically praying to die. It's embarrassing to say this. I'm supposed to be bringing hope to people, but I had lost it. I mean, when I entered airplanes, rather than praying for the safety of the passengers, which was my typical thing, I started praying that the plane would just crash and I'd die because I just couldn't see myself going on.
Wow, you were really suffering, and it must have affected your work.
I was working, but I'd say my workload was down to about 60% because I would constantly have to lie down, constantly have to take breaks. I just, even emotionally, was having trouble with my workload. So, yeah, I was about 60%.
How did you find Take Courage Coaching?
My sister is the palliative care coordinator at a hospital in Montana, and she told me that I really ought to take a try at this. And I didn't believe her. I said, I just can't see how that could make any difference at all, taking away my pain. But she could tell I was in rough shape. And so she really convinced me to do it. And so that's when I finally did give them a call.
Well, let's talk about Take Courage Coaching now. What exactly does the program entail?
It really is a program designed to educate you about how you can tackle your pain and your treatment by educating you about different things. Certainly it covers a whole gamut of things that will equip you to best cope with the pain. It doesn't directly, of course, take the pain away, but it really helps you become optimal to be able to live with that level of pain.
Those sound like great strategies. When we come back from the break, we'll talk to Jim about the global improvement that he's had from Take Courage Coaching. I'm Dr. Paul Christo, and you're listening to Aches and Gains.
Aches and Gains is supported by Medtronic, the global leader in medical technology, alleviating pain, restoring health, and extending life for millions of people around the world. Mylan Pharmaceuticals, one of the world's leading generic pharmaceutical companies. Discover why at Mylan, quality isn't just a claim, it's a cause we've made personal at SeeInsideMylan.com. Purdue Pharma, making a positive impact on healthcare and on lives, reminding everyone to safeguard medications in their home.
And we're back. Jim, if we take a step back for a minute, what has been the influence of this particular coaching program on your life?
This has changed my life. Doing Take Courage Coaching really has, because I was filled with so many fears and hopelessness. And here I am supposed to be giving hope to people, and I didn't have it myself. And through the process of Take Courage Coaching, just the things that you're learning with the program, I started getting my courage back. I said, you know what, I can do this.
Wow, I mean, that's really great. Which particular strategies did you find the most successful?
There's so many. I think that time management was one of them, the relaxation techniques, how to breathe. I had to learn that, about how to do some deep diaphragm relaxation breathing. That took some time for me to learn. Humor therapy, just lifestyle changes, how I exercise, the foods I eat, incorporating more stretching into my life, and just even sleep habits, stress strategies. There's so many things that she covered, and I go back to constantly and putting them into practice in my life.
You know, Jim, the program is a year long. When did you begin to experience some relief?
I'd say probably 3 months into the program. And I said, look, I don't think this is going to work. And she said, well, why don't we at least try it? I was just believing some lies. Like I kept saying, there's no way I can handle this. And she would say things like, well, is that true? I said, well, yeah, that's how I feel. She goes, no, but is that true? How long have you been doing this? How long have you been in pain? And she said, see, you're believing lies. I thought, well, yeah, I guess you're right. So it took me a while to get my thinking on straight, and then I started to see results within about 3 months.
3 months, many of my patients, for example, would feel that 3 months to get some relief is an eternity. But at the same time, it seems like Becky helped you lessen the impact of pain on your life by giving you a number of coping techniques. What happened in time to your pain? I mean, did your pain increase or decrease as the program continued?
Over the next about 8 months, I continued to see increasing results. And then it kind of leveled off after about a year, even though at this point I still see an increasing result, but it's much slower.
And Jim, what does the coach in these programs actually do?
The coach will, certainly ask you how you're doing, how you're feeling, what's working, what's not working. But then the coach is there also to help you with your thinking, to what is right, what is an exaggeration, what's true, what's not true. And then it's a constant reminder of what works. And of course, with other people on the phone, being able to share victories as well, like what's worked for them this week. It's encouraging that, well, what one man can do, another man can do. So certainly I can do this as well.
Absolutely. I think it's extremely empowering to hear the successes of others. Jim, how long is each session?
About an hour.
And tell us about the group sessions.
The group sessions were very encouraging. About once a week is, I think, what I was doing. All your emotions are saying, this will never work, this won't work, I've tried this. But the courage is there to say, okay, let me try this, let me do this, and go for this. And then you see the results, and it's like, wow, this actually worked.
I really do admire your courage. Jim, it seems like the $6,000 cost, which is not covered by insurance, is pretty high.
I remember telling doctors, look, you get me out of pain, I'll give you $1 million. Now, look, I didn't have $1 million to give, but one of the things that really started getting my attention is like, what have I gained from what I've done so far? I'm still in just as much pain as I was before I saw all these doctors and surgeries and treatments and medicines. And so I thought, okay, if I'm not paying all of that I can pay for something else.
Mm-hmm. I mean, it makes perfect sense. And in fact, do you feel that this program would benefit anybody in pain?
Yes, absolutely. In fact, I've thought that many times that this would be good for people that are struggling with anything in life, because it's really helping your body and your mind to be optimal, to be able to handle the chronic pain that you're going through.
It's the handling and the coping of the pain that seems like is the most useful from our program. Jim, what can you do today that you couldn't do before the program?
One of the things is my work. Not only am I back to about 90 to 95% of my work, but boy, I'm a better minister, I'm a better husband, I'm a better father, I'm more compassionate, I'm more understanding. This has changed my life. It's given my hope back.
That's wonderful. At the same time, what didn't you like about the program?
I had to carve out time in my schedule. And of course I did have to, realize that there is a cost to this, and the fact that it did take time for me to see results, because I was looking for a pill, I was looking for a lever, I was looking for a button, somebody to do something to take this away quickly. And it's not a quick solution.
No, it's not. And even though that's what many in pain are looking for, if they're patient, this program might work for them too. Jim, how much better do you actually feel?
I'm not out of pain, but my experience of that pain has greatly dropped. Whereas before it was running my life, now I run it.
That's terrific. Jim, Becky Curtis, the founder, says that her program provides the missing link in pain management. Does it? And what is the missing link?
The missing link is us taking charge of what we can do to help our bodies and our minds to be able to handle the chronic pain we feel.
This is a great example of a self-management strategy. And Jim, are you taking any pain medications today?
I haven't been on any kind of pain medication for almost 2 years probably.
Good for you. And Jim, before we close, is there hope of regaining your life when you have chronic pain?
Our vision of the future when we're in chronic pain is rarely positive, and it's rarely accurate. And I think that when we see that we can get involved in our pain management, when we can change our thinking and rewire our brain, that will give us exactly what we need.
Absolutely. And Jim, I want to thank you so much for joining us today on Aches and Gains.
Great. It's been nice talking to you.
Up next is Becky Curtis, founder of Take Courage Coaching. I'm Dr. Paul Christo, and this is Aches and Gains.
Aches and Gains is supported by Endo Pharmaceuticals, a U.S.-based specialty healthcare solutions company that delivers innovative diagnostics, drugs, devices, and clinical data to meet the needs of patients in areas such as pain, urology, oncology, and endocrinology. Horizon Pharma, a biopharmaceutical company that develops and commercializes innovative medicines to target unmet therapeutic needs in arthritis, pain, and inflammatory diseases. Pentec Health, one of the nation's largest pharmacy and nursing companies, dedicated solely to providing in-home care for patients with implanted pumps used for the treatment of severe pain or spasticity.
Welcome back to the show. A spinal cord injury left Becky Curtis with continual pain and more disengaged from life. But in 2008, she put together a unique, at-home, year-long program called Take Courage Coaching. This is the same program that helped Jim Brown redirect his focus from pain to active engagement in life. Becky, welcome to Aches and Gains.
Thank you.
As I mentioned earlier, you suffered a severe spinal cord injury yourself a few years ago. What happened?
Yeah, about 7 years ago, I fell asleep while I was driving through the Big Hole Valley of Montana, and when I hit the gravel, I overcorrected and rolled about 100 yards and broke my neck, and both my lungs were collapsed.
I'm sorry to hear that. What happened then?
Well, I was then taken to Butte, Montana, where I had my neck fused. I have an incomplete spinal cord injury. I'm a C4 incomplete quadriplegic, and I was left with what's called Brown-Secord syndrome, which means that on my left side I have spasticity and muscle weakness, and my right side I can't feel hot or cold, sharp or dull.
Well, I mean, that's a severe, life-altering experience. And how has it impacted your life?
Well, I had to learn how to walk again and had to learn how to do life with disability. I was doing pretty well with the pain until 2 years out. And when I started having burning nerve pain from my neck to my toes, and we couldn't figure out what it was, finally the doctor decided to do an MRI and discovered that I had developed a syrinx, which is a small fluid-filled cyst in the middle of my spinal cord, which was causing burning nerve pain from the neck down.
And Becky, how did they treat the syrinx that was causing the burning nerve pain?
By the time they would titrate the medication high enough to turn the pain down, I wasn't very functional. And so I was just really discouraged. I was in a really hopeless place at that point.
And was it from this place of hopelessness that you developed the concept for Take Courage Coaching?
Yeah, I discovered there was a lot of things that I could do to manage my experience of pain, and I started reading everything I could get my hands on and asking a lot of questions of my doctors. And I decided that I wanted to spend the rest of my life helping people that have chronic pain. And I started developing the curriculum and the modalities for Take Courage Coaching.
And tell us specifically what the thrust of Take Courage Coaching is.
We teach them lots of different methods of unlearning pain.
Well, and let's talk about unlearning pain. What are you coaching people to actually do?
The program is a whole year-long program, and so we have a different modality for each week of the year. But it's a lot of different things, like I'll just tell you a really simple one, breathing from the diaphragm. That is just one out of 52, like I said. And my own personal story with breathing from the diaphragm is that I can bring my nerve pain from an 8 to a 4 with just a couple of breaths.
And then tell us more about the other sessions or modules of the entire program.
Sure. Sleep hygiene, that's one of the first lessons. Understanding the mind-body connection. When we have negative thoughts, that affects our experience of pain. And learning how to turn those negative thoughts around. A lot of times when we're hurting, we think, if I don't move, I'll feel better. Or if I move, it hurts more. And so we stop moving and we get weak muscles on top of whatever other pain issues that we're having. So those kind of things are what we work on with people.
And let's go back to unlearning pain. Could you give us an abbreviated course? I mean, could you distill the 12 months into a couple of minutes?
The program is a whole year-long program, and so we have a different modality for each week of the year. Just giving them their control back, putting pain as servant and not master.
I like that analogy. In reading your materials, it seems like active engagement is the key. How do you do that?
Well, it is a process. And finding out that there were some things that I could do to control my experience of pain, that was powerful for me. And so giving them a sense of control, giving them a sense of, I can do this, and then walking alongside them as they do it.
Yes, being present as a guiding force can be extremely therapeutic. Becky, what's the difference between individual and group coaching sessions?
We let them pick the agenda. They have an individual session with their coach once a week, and they have a group coaching session. In the group coaching session, the coach teaches the module for the week. And so during their individual session, they can choose to make goals around that, or maybe it's something else that they're needing to make goals around instead.
Yeah, it seems like you're advocating, actually, that your program might be used instead of medications or interventional treatments like nerve blocks or other procedures.
Well, that's an interesting observation. I don't have any problem with medication. I think it should support functionality. And for a lot of us, by the time the medication is high enough, it's really difficult to be functional. I don't have anything against interventions. What we're trying to do is really encourage people to have their own personal pain management plan.
I think that would be helpful actually in concert with medications as well as procedural interventions. Becky, what can patients in pain or clients in pain expect in terms of improvement in their quality of life from Take Courage coaching?
Pain has been cut in half. Their mobility has gone up. Their activities of daily living have improved. Their vitality has improved. People have been able to go back to school, go back to work, and really engage in life again.
That sounds encouraging. Are there certain types of pain that Take Courage coaching deals with most effectively?
Failed back, fibromyalgia, CRPS, RSD, pharynx pain like mine, shoulder pain, migraines.
And Becky, have any clients dropped out? And if so, why?
Oh, yeah. People drop out. I think that it takes a certain amount of readiness. That's what we're looking for, is people who are ready for something different.
Okay, fine. But what about the limitations? I mean, there are limitations on what I can do. What about yours?
I think the limitations are that it's hard to get people to understand how talking to somebody is going to help their real pain. Probably length of time. I wish it was a quicker fix for people. But it's kind of a slow and steady wins the race.
Yes, I mean, I see that too. On the one hand, I have patients for whom a quick fix works, but in others, it takes a while for therapies to achieve an effect. And finally, how can Take Courage coaching help patients move beyond their pain and give them hope?
Well, what we do is we come and walk alongside them, and as we're handing them tools, not only do we hand them tools, but we try to give them the encouragement and support that they need as they make the changes that they need to make to move forward in their life.
Becky, I want to thank you so much for joining us today on Aches and Gains, and I wish you great success in your program.
Thank you very much. I've enjoyed talking with you. Thank you, Dr. Christo.
Tune in next time when we explore another interesting topic on Aches and Gains. Follow us on Twitter at Dr. Paul Christo and like us on Facebook, Aches and Gains. Aches and Gains is supported by Medtronic, Mylan Pharmaceuticals, Purdue Pharma, Endo Pharmaceuticals, Horizon Pharma, Pentec Health, and Boston Scientific. If you have any questions or comments for Dr. Christo, please email him at achesandgains@gmail.com.
Here we have an email from Dolly in Jackson, Mississippi. I have a non-union fracture just below my knee joint along the fibular head with constant pain. My knee rotates and gives way 2 to 4 times a month, causing me to fall. What kind of surgery should I consider? I control the pain with medicines and acupuncture, but they're not a cure. I need some sort of surgery to mend the non-union fracture and perhaps tighten the ligaments. Well, Dolly, I would see an orthopedist for guidance about possible surgery. You may have developed some arthritis in the area of the non-union fracture, which is causing the pain. For example, you may have developed osteophytes, which are bony overgrowths, or even cysts in the area of the non-union. Consider imaging the knee with X-ray first, then an MRI. Physical therapy, braces, and strengthening the quadriceps often helps. If surgery isn't an option, then there are topical anti-inflammatory medicines used for osteoarthritis of the knee, One is a diclofenac gel called Voltaren, and the other is a diclofenac solution called Pensate. I'm Dr. Paul Christo, and you're listening to Aches and Gains.
The views and opinions expressed in this radio program are solely the views of Dr. Paul Christo and do not necessarily express the views of this radio station and Johns Hopkins University School of Medicine, nor an endorsement by any or all of them of any of its content. This show provides medical information, not advice. Please consult your personal physician before engaging in any course of treatment or use of any of the techniques or products discussed on this show. Discussion of particular uses of products on this show have not been approved by any of the manufacturers of such products. To access podcasts of the show, please go to paulchristomd.com. That's paulchristomd.com. Aches and Gains is produced by Tom Blair and Ty Ford. Elsa Langford is the technical consultant and engineer. Dr. Paul Christo is the executive producer. Thanks for listening. This is Aches and Gains with Dr. Paul Christo.